I'm going to talk about pelvic neutral today. So pelvic neutral is the independent position of our pelvises under our spine. So the pelvis can be sticking out like so, and we get an extended bottom stomach posture, and it also lowers our height, or we can tuck our pelvis in and we can get a flattened spine and a raised posture. So what we need to learn is what the extreme of one position called flexion is versus the other extreme called extension. One of the things we need to have is a neutral pelvis, one that's the halfway between extending and flexing. So if we look from the front, we have pelvises that can move separately, we have lumbar curves that can move separately, we have chests that can move separately, thoracic spines that is, and we have neck and head that can move separately. So in the worst case scenario, our pelvises are in extension, our chests are sunken down and our chin's out, and I walk along the road a little bit like this. If I want to change my pelvis, I want to flex slightly, I want to raise my sternum and push my chin in. So these are different elements of movement, like balls stacked on top of each other. One moves this way, the other moves that way. One moves this way, the other moves that way. We don't need to know all these changes. Today we're just going to talk about separating the movement of the pelvis so that we get to know what that feels like. It isn't a movement of the upper body, it isn't movement on the feet, it is clenching your stomach to flex and flatten, and relaxing the stomach and clenching your back muscles to arch your butt bottom out. Now we can get a fixed pattern of extension by having tight quadriceps and a weak abdomen, or we can have a tight spasmy back muscles and short hamstrings. So the solution to this movement here, one, is to learn what extension is and what flexion is and what neutral is. That's the halfway point. If I'm standing here, can I move my top of my pelvis, my belt area, as far forward, if I come back to neutral, as I can backwards? If I can, that's neutral. Neutral, extension, neutral, flexion. So I don't want to walk around like this. That squashes all the discs at the front of my spine. Neither do I want to walk around like this. That squashes all the joints. The pressure on the joints causes degenerative change of the facet joints. The pressure on the discs causes disc herniation and disc compression. What we want is a pelvic neutral, balanced body strengths. One of the best things we can do for trying to save ourselves from extending too much is to do core strength. Check out the core strength video. The other things to do is to stretch our quads. So we're going to bring our knees together, heel to the buttock, and we're going to try and get a nice lengthy stretch there. Same thing on the other side. It's good to stand on one leg and see if you can balance, just to increase your proprioception from your ankle joints. The second stretch would be your hamstrings, keeping a flat back, chest out, trying to touch your toes. If that's difficult, you can put your foot on a stool, keep your back flat, and try and touch your toes. Strengthening of the buttocks and the lower back is done by holding a position here, keeping up there for 1 minute, taking away one leg for a few seconds, changing over, and trying not to drop the spine. Don't do this and this. So you hold up, no change in movement here, hold up. So this is 1 minute, and that's just a few seconds of tolerance. The next exercise for the spine, back muscles, is the flexed standing posture, knees pointing back, called foundation exercises online. We're trying to push our chest out, straighten our arms, and hold that pose for 1 minute. We can also change to that pose for another minute. So our knees are pushing back, our spine is flexed, and our chest is sticking out. Try use those exercises for a pelvic neutral. First, find where you are in neutral. If you can't go forward, you're clearly in extension. If you can't go back anymore, you're clearly in too much flexion. If you're in the middle, you should have some range. If you don't know what that range is, learn it. If you want to try those strengthening exercises and the stretches, see what you can do, come to us and we'll tell you exactly where you are and give you a precise arrangement to fix it. Cheers.